So at this point here, we'll begin to talk about this is Cecilia Nkemakolam Foundation, and this is a video clip based on the recommendation for the Action for Women's Health program proposal um, funded by Pivotal and managed by Leverage for Health for Change, and then Submittable. And this is our own video. We're just going to show our profile and our capacity to be able to implement the program, the project that we have, you know, clearly written concerning the strengthening of the adolescent girls and young women who are female sex workers and female drug injecting users. Those who inject drugs, the female aspect, the female ones among them are our key areas, our target population, which we're concerned about because they have face a lot of issues about rights, issues about stigma, and then involvement in, and so that we can be able to empower them through education and engage them effectively. And they're human beings, so because they are key population, they're most at risk population in terms of in transmission of HIV/AIDS. And so we are taking a proactive step in prevention of the and reduction in HIV/AIDS transmission. By providing service and intervention in this area, we'll be able to reduce effectively the HIV epidemic. And so we have used this opportunity to express our organization and our capacity. This is our capacity profile, and this is Cecilia Nkemakolam Foundation, like I mentioned. And here you can see where we have our institutional capacity just at a glance. You can see our name, you can see the sector where we work on as a non-profit and civil society organization. We have been existing since 2003, and we're fortunately registered on the 7th of June 2012. And we are also registered with the Corporate Affairs Commission of Nigeria. We also registered with SCUMO under the EFCC for money laundering, and we also to combat against money laundering, and we also were registered with the Federal Inland Revenue Service, which is the FIRS, and we have a team. And then we also registered with the US government, and we have a UEI number and registered under SAM, so that we can be able to access and also implement activities in that by any activity from the United States government and its allies. And so we also registered with the European Union, and we have our number, the European Aid ID, and we also enjoy special consultative status with the United Nations, and we since 2010, and also we also have our head office in Nigeria, in Abia State, and we also have zonal offices in Abuja, and we have other offices in Akwa Ibom and Lagos. And so we also operate from other territories. As the need arises, we can set up field offices and be able to implement our activities in that area, even if we don't have a physical presence, we can, provide such services, such of locations, through our head office. We can, as long as we are implementing programs in those areas, we can provide a field office, a small field office, to coordinate our activities within the time frame and within the period the project is supposed to be on or be carried out. And so we have other things like our staff strengths. We have about 35, permanent staffs and volunteers. And so We also go into our profile. We have been existing, like I said, since 2003, and we have a strategic approach, and that has been to deliver revolves to women and poor people in local communities to collaboration, learning processes, and adaptive management to achieve sustainable development outcomes in health, education, leadership, and entrepreneurship. We have worked with several donors. We have worked with the USAID under Enhance, with UNDP, with the US Consulate. We have also worked with other organizations, Society for Family Health, Action Aid, the National Malaria Control Program, Elimination Program, and the World Bank, and also Vitamin Angels, and then the Institute of Development Studies of the University of Nigeria. And so we have also worked with community stakeholders who have worked with schools within local communities, who have worked with health facilities, especially primary health facility system at the local levels, able to provide services for maternal and child health. And we have also worked in those areas extensively. And we have also worked with private establishments to fund us in one way or the other, like Tamakul, and then other organizations were coming and Plaque. And so we have also worked in various areas uh, in this regard. And so we are here to say that we have also, so under our program and our project that we are working for to strengthen the adolescent girls and young women, especially the key populations of female sex workers and those females who inject drugs. We're particular about this category of people, their target population, and the project that we're delivering will provide services for these people, comprehensive services from structural interventions to behavioral interventions to biomedical interventions in these areas to be able to provide services for them. There are rights issues, there are gender issues, there are to ensure that their rights are protected and their gender equality, and then they are able to receive these services in order to reduce and prevent the spread or transmission of HIV/AIDS in Nigeria, which is still relevant. And Abia is a very critical area in terms of the population, and there are a lot of brothels and hotspots in Abia State, and there are people, but they lack some of these interventions. There are none of these interventions apart from the one that were done in 2013 to 2016 by World no World no 2016 12 to 2019 by World Bank, and a few other partners have come to before the key population and the size estimation survey that was done by the Abia State government, with which we are trying to provide these interventions based on the information of that survey. And so that's the essence of this program that we're trying to do in um, to be able to play a role in this intervention supported by Pivotal and uh, Leverage for Change. So this is what it is, just going to be briefly. And so this is our structure. Our structure is built in such a way that we can be able to um, we have an organization where we have structures, we have the board, we have the executive committee, and we have the management team to be able to provide the services. And we have project team made up of 5 key qualified people who have experienced several years of experience, 20 years, 22 years, and 15 years, 18 years on providing services to these people. And we have these departments and we have the structure. We have been able to implement projects. The last we did was a World Bank project, and which was over 317 million in terms of naira. But if you equivalent in dollar, it should be about 2 point something million dollars. And we have put all of that in the document, in the proposal that we have written to submit to you. So we're just in a video that will just capture all of this, and this documentations, and these are all the capacity profile that we have, the structure, the human resource, and all that we have, the individuals that we have in the program to be able to, we have to be able to support a sound program effective implementation. We have our documents, we have our registration documents, we have that from FIR, we have that from a National Population Commission, we have a Planning Commission rather, and then we have that from SCUMO, Certificate of Registration, the team, and the tax exempt, and then the picture of our offices, and we have a financial policy that guides our use of funds. And so we have an annual budget, and we have audited accounts by NSO, NSO. And we have all the other evidence of our activities, programs that we have done in the past, and all of these and pictures of activities that we have been able to do in the area of HIV, malaria, women's health, and then children and all of that. And so we have certificates of completion of projects that we were able to implement in the past. And so we have recommendation letters from organizations that we have worked with in the past, we have partnered with in the past, and they have all recommended us in different areas. And so we believe and we know that we have capacity for the implementation of this project. Thank you very much.